Why are duodenal ulcers difficult to heal? Duodenal ulcers can be quite challenging to heal, and there are several reasons for this. One major factor is persistent acid secretion. The duodenum, which is the first part of the small intestine, is exposed to gastric acid from the stomach. When there is excess acid, it can continuously damage the protective lining of the duodenum, making it hard for the ulcer to heal. While proton pump inhibitors are commonly used to reduce acid production and help with healing, if these medications are not used properly or are stopped too soon, the ulcer may not heal and can even come back. Another significant issue is the presence of Helicobacter pylori, a type of bacteria that can infect the stomach and duodenal lining. This infection causes inflammation and weakens the mucosal defenses, making healing more difficult. To heal effectively, it is crucial to eliminate this bacteria with the right antibiotics. However, antibiotic resistance is becoming more common, which can make it harder to treat the infection and, consequently, the ulcer. The use of nonsteroidal anti-inflammatory drugs, or NSAIDs, is another factor that complicates healing. These medications can interfere with the production of prostaglandins, which are substances that help protect the mucosal lining and promote healing. If someone continues to use NSAIDs while having a duodenal ulcer, it can hinder the healing process and increase the risk of complications. The size of the ulcer also plays a role. Larger ulcers, or those with fibrotic tissue, which is scarred tissue, tend to heal more slowly. This is because the damaged tissue is less capable of regenerating. In some cases, these ulcers may require longer treatment durations or ongoing therapy to heal properly. Sometimes, ulcers can become refractory, meaning they do not heal despite standard treatments. This can happen due to complications like ongoing bleeding or other medical conditions that interfere with healing. Additionally, lifestyle factors such as smoking, alcohol use, and stress can negatively impact the healing process by affecting blood flow and repair mechanisms in the mucosa. In clinical practice, most duodenal ulcers respond well to a combination of acid suppression and the eradication of Helicobacter pylori. When treatment is adequate and followed correctly, healing rates can exceed 95%. However, for those with larger ulcers, resistant infections, or complications, healing may take longer and requiring careful management. In summary, the difficulty in healing duodenal ulcers often arises from a mix of ongoing damaging factors and the challenges of addressing these factors effectively. Proper management involves reducing acid production, eliminating Helicobacter pylori, avoiding NSAIDs, and sometimes extending treatment for complicated cases. Always consult a healthcare professional for personalized advice and treatment options.